as well, former FBI agent, now a fellow at the Brennan Center for Justice. That does it for our show. I'm Amy Goodman with Juan Gonzalez. Thank you.
The viewpoints expressed in this program are the opinions of the people expressing them and are not necessarily those of Fresh Air Incorporated, its staff, or its board of directors.
I'm Al McFarlane. Welcome to The Conversation with Al McFarlane. I'm glad to be here and glad to have you along as well. A special shout out to all of our listeners on KFAI. What a wonderful place, a wonderful community this is. What a wonderful way to stay connected to each other and to the world with people that sort of are looking at the same thing, kind of in the same way, with an eye towards justice, an eye towards equality, and an eye towards helping everybody be her or his best self. Well, we've got a great program today. Today we're going to be talking with a leader in a new medical resource. Pandia Health is opening doors here in Minnesota. We'll talk with Dr. Sophia Yen about that. We'll also talk later in the program with two of the leaders of Twin Cities Habitat for Humanity, Shereese Turner and Robyn Bipes-Timm are here to talk about housing challenges and opportunities. First, let me remind you and invite you to support this program, not only by being a loyal supporter of KFAI, but also by supporting the conversation on our social media platforms. We're asking everybody that's listening and that's watching on any of the several platforms that we're on to, before the program is over, get over to the YouTube channel, the Insight News YouTube channel. We're hoping to grow our subscribers at the YouTube Insight News channel from around 300 right now. We want to reach 1,000, and you're acting on that. If you can go to your social media or to your computer or phone and log on to the Insight News YouTube channel, subscribe to this program, like us and share us. Tell everybody you know that we're live right now on KFAI. This is The Conversation with Al McFarlane. I want to begin with the hot topic, and today's hot topic is a story that's in Insight News, and the story is about the family of Amir Locke, who was killed in the no-knock raid, suing the city of Minneapolis. You all are familiar with that. We're really at we're at an anniversary. I think it was about a year ago that this event went down. The article by Associated Press online today at insightnews.com says that parents of Amir Locke, who was shot to death by a Minneapolis police officer when a SWAT team executed a no-knock search warrant a year ago, sued the city and the officer Friday, alleging he was gunned down in cold blood in violation of his constitutional rights. Locke was 22, and he's Black, obviously, and had hoped to build a career as a hip-hop artist. He was sleeping on a couch in his cousin's downtown apartment when authorities entered without knocking on February 2nd, 2022. They entered the apartment as part of an investigation into a homicide in neighboring St. Paul, in which Locke was not a suspect. Body camera video showed that Locke was holding a gun before he was shot seconds after the officers burst in. And so Locke's mother, in her statement this week, said, quote, "This has got to stop." Karen Wells told the news conference that Amir will be the face of banning no-knock warrants. He will not die in vain. So that's our hot topic today. Follow that and follow other developments in that story. Obviously, the story is developing out of Memphis, Tennessee, and others. A lot going on, a lot to pay attention to, but that's what we have to do. It's exactly what we have to do. Let me begin then my program by bringing in Dr. Yen. And Dr. Yen is, I read some articles a few days ago about the value, the opportunity to create a woman-owned, woman-led medical facility that's dealing primarily with women's health. Dr. Yen, Dr. Sophia Yen, welcome to the conversation. I'm glad to have you here.
Thank you so much for having me. I'm excited that we just launched Minnesota end of January, beginning of February, and we're bringing expert doctor care, evidence-based care to wherever you have internet and a mailbox. So, hey, Minnesota.
Welcome. So let's do Pandia Health 101. Describe the vision, the product, the service, and how it works.
So came up with the idea about 8 years ago. I was giving a talk to a bunch of doctors. Why don't women take their birth control? And one of the top reasons was didn't have it in their hand, didn't have time to run every single month from age 15 to 50 to the pharmacy, stand in line, wait for the meds, and come back home. And it was just the beginning of everything coming in the mail. So my friend and I are like, we could solve this. We will just ship you birth control and keep shipping until you tell us to stop. And then we ran ads, free birth control delivery. And then 60% of the people that responded didn't have a prescription. And I didn't want to run ads where 60% of the ads were useless. I'm a doctor. I can write prescriptions. And thus Pandia Health was born. If you have a prescription and you have insurance, thanks to Obama, Biden, any FDA approved birth control should be available for free, no copay, no deductible, unless you have a religious employer or an exemption or something like that. And then if you need to use a doctor, it's only $25 once a year to use our expert doctors.
Let's talk about the environment for women's health in these times. I think everybody's focused on what the recent Supreme Court actions meant. What have those decisions meant for women in general, your patients in particular? What's the general feeling, the level of either knowledge or anxiety in the community about birth control and childbearing or options?
Yes. So I think I know we saw subscribers go up 3x after the Dobbs decision to reverse Roe v. Wade, because if you can't access that decision, then you better get your birth control under control. And the whole point of Pandia Health, the whole reason I created was no one runs out of birth control on our watch. But also we've come up with an algorithm that results in 82% of people new to birth control staying on it at a year versus the regular 55%. Because as a woman of color, I realized what I was taught at the academic institutions, UCSF, Stanford, etc., works great if you're a Caucasian female that wants to bleed every month. But if you're Asian, Black, or don't want to bleed with every month, I used my MIT, UCSF, Stanford brain, took all 40 birth control pills, ranked them from most likely make you bleed, least likely make you bleed, most likely give you munchies, least likely to give you munchies, most likely give you zits, least likely to give you zits, and optimized it. And so our patients don't have side effects, or if they do, when we check in, we can tune this up, we can tune this down and choose from the 40 pills and give you the best thing with the least amount of side effects based on your age, body mass index, and then just in general, if you want to bleed, you don't want to bleed, or other issues like that.
What are your thoughts on the Biden Obamacare contraceptive mandate? How does that affect your business and your work?
The Obama-Biden mandate was one of the reasons I created the company, because it was going to be free. You pay us nothing if you have a prescription and insurance to cover it. You only pay us for our doctor's time and overhead and whatnot if you need to use our doctors. But if you already have a prescription and you have insurance, just tell us where it's at. We move it to our pharmacy and we ship it to you. And then we also try to make sure you don't run out. So 2 months before the prescription runs out, we're like, go see your doctor. 1 month,
Mm.
go see your doctor. And then every day until it expires, hopefully you deal with it before it expires. But then we're like, go see your doctor. And then now that we've launched in Minnesota, you can use our doctor if your doctor's office is backed up, or you want to, start with the best possible company that has the most expertise in birth control. Because I realized I've spent the past 6 years only doing birth control. Other people have been doing COVID, runny noses, etc. All I do is birth control.
Women-founded, women-led, doctor-led. Talk about that. I mean, why is it so important? It seems like it's a no-brainer, but it isn't often the case, all around. And this is really innovation.
Yes. I want everybody to know not all telemedicine is built the same. There was telemedicine 1.0, which is quick, fast, cheap, online. But if it were me, my daughter, my friend, my patient, I want the best and the brightest. I want the long visit because I want you to ask all the questions and not miss anything. And so that's the difference between a women-founded, women-led, because I'm out here to make life better for those of us with uteri. And then doctor-led, I'm one of the few CEOs that has taken the oath, do no harm. I cannot say that the same of my MBA, not to diss all the MBAs out there, but they're focused on the bottom line. And at Pandia Health, we're here to be your friend forever. We chose Pandia for Pan every and Dia day. We want to be with you from your first period throughout your entire life. We're doing birth control, acne. I'm of menopause, so we're doing menopause, and then we're going to do everything else. So I don't want to give you something crappy, and then you're like, bye-bye. I want to be with you forever. And so it's our interest to always tell you what's best for your health, even if it doesn't benefit our bottom line. And as long as this company holds my values, that's what I promised you. We will always tell you what's best for your health, even if we can't make money off of it, because we'll catch you later.
Well, let me ask you, other than uses for birth control, or what other uses for birth control are there outside of preventing unwanted pregnancies?
So there, 70% of those of us with uteri who take birth control are actually using it for other things as well. The number one cause of missed school and work for somebody under the age of 25 is bad, evil periods. So if you are missing school and work or just suffering deeply, please see a doctor. And my evangelism is #periods optional. Go to pandiahealth.com/periods optional. At the bottom is my TEDx talk on you don't have to bleed every single month unless you're trying to get pregnant that month. Bleeding every month is so 2020. Get with the times. All the doctors and all the people in the know are not bleeding every month. And that decreases your risk of cancer and anemia and landfill that you're generating.
And so my note here says that 89% of doctors are unaware that Plan B, for example, acts as a placebo if your BMI is 26 or higher and much more. How does this affect Black women? What's the story? What's the difference with Black women?
Yes. So the researcher that did this is actually a Black professor, OB-GYN doctor, and she was hoping that if you doubled up on it, it would be enough to cover it. But unfortunately, it doesn't work that way. And so if your doctor doesn't know the BMI cutoff and doesn't know that there is a BMI cutoff, and women of color are more likely to be on the heavier side, and my BMI is 25 right now, and if I eat some extra dessert, it hits 26, then I take the Plan B and I think I'm preventing unplanned pregnancy, but I'm wasting money and it's useless. So at Pandia Health, and I make no money from this, I just want to prevent unplanned pregnancy, we recommend Ella. Ella is a prescription emergency contraception, and thanks to Obama Biden, if you have insurance, it's free. It's covered. It costs you nothing. And you can ask for a prescription that can expire in 2 years. So you can ask your doctor to either write, which what we do at Pandia Health, please give the patient the one with the farthest expiration date. Or when you go pick it up, they give you the one that expires this month. You're like, I want the one that expires far away if you're not using it today. So the take-home message is check your BMI. If it's 26 or greater, Plan B and its generics don't work so well. And if it's 30 or greater, it doesn't work at all. And if it were me, my daughter, my friend, my customer, this is my public service announcement today. Please consider Ella instead. And I make no money. I'm just trying to prevent unplanned pregnancy.
Let me take a few minutes to ask you about your personal story. Number one, how you came to medicine, how you came to the passion. You described it a little bit. Let's go deeper with that. But then I also want you to, if you're willing, Dr. Yen, to talk to Al, the guy, right? And so I'm a dad, I'm a husband, I'm a grandpa, you know, and too often I think we remain oblivious to the obvious, and we're not encouraged to, and sometimes we're not motivated to know. But I
Yeah.
think that the opportunity to know exists. And I think that you're bringing conversation that ought to be public knowledge for everybody, right? So I'd like you to, in the course of the next few minutes, think about and reflect on what role men can play in supporting knowledge and access and empowerment for the women in our lives. So, your background first. How did you come to medicine, and what's your personal story? I love your energy. First of all, I'm going to let you know that you are on fire, and I love it.
Oh, thank you. Um, I love this story, and I just happened to find my sticker book. For those of us of a certain age, we used to collect stickers, and the new ones also collect stickers. And as a fourth grader, I kind of got more stickers because I told my mom, well, I'm going to be a doctor someday. And so I need more than just one page because, like, if they take it, then the other kids won't have it and they'll be sad. So that was kind of my way to get more stickers is I'm going to be a doctor someday. But the real reason I did that was I love people and I love science. And that is the beauty of medicine and the health profession is you can use your brain to help other people prevent badness such as unplanned pregnancy, sexually transmitted infections, obesity, diabetes, heart attacks, smoking leading to lung cancer, vaping leading to lung cancer or addiction, other stuff like that. So that's why I became a doctor. And then why adolescent medicine? I was working at Planned Parenthood as a pregnancy results counselor. I was 15 and I ran a test for 13-year-olds and it came back positive. And I was like, oh, and I went in, your options are, and they had somebody come in after me, but your options are to continue the pregnancy, terminate the pregnancy, or give it up for adoption. And she didn't blink and she's like, I'm going to keep this. And I was like, oh, and knowing just how different our lives were going to be. I would go on to MIT, UCSF, Children's Oakland, Berkeley, Stanford, become the CEO of a company. And she would have a very hard time as a 13-year-old getting through high school. Would she even go to college? And certainly I totally praise and respect the women that do get through this, but it's just a lot harder. And so that really motivated me and made me realize that those of us with a uterus, when you have heterosexual relations, we're the one that's going to suffer. The dude can walk away. The dude can also stay and be supportive, but it's not as common, right? And so but you can have sex. You just don't need to get pregnant and sexually transmitted infections. And that's why I like adolescent medicine. We can catch you at the beginning and be like, are you sure you want to have sex? You want to do other stuff instead. Don't risk pregnancy. Don't risk STIs. Okay, you want to have sex. Then here's condoms and here's some really good birth control. Because we have really good birth control that works 99.9999% of the time if you combine it with condoms because you got two stuff going on. And then if that doesn't work, then we catch you with emergency contraception. So there's many options, but it's about access. And that's part of why I started this company. We're bringing access wherever you have internet and a mailbox. As to your question about men, I love the allies. I am so thankful for you, Al, as an ally, as a man of color, as a respected community member, saying that we need the men because this affects everyone, like everybody. This is why I wear the uterus necklace. I'm one of the few CEOs you're going to see with a uterus necklace and a condom bag. But the uterus necklace is because we all came from the womb. Respect the womb. You have a mother. Right now, nobody can escape the womb. And oftentimes you'll have a sister or a partner and a daughter. And so educated people should know about birth control options. Educated people should know about abortion rights, reproductive justice, because that includes your your ability as a family to decide when and how many children you have. And if you are having babies when you don't want to have babies, it's going to mess up your career trajectory. Or if you're having far more babies than you can afford to have, it's your body, your family, your choice. But it doesn't just affect the person with the uterus. It affects everybody, right?
Let me ask you, you might not answer this, or you might, but what role does religion play? What have you discovered is the impact of religion in the arena of reproductive health?
So I love the religious groups that support the right to decide according to your religion. Because even people amongst the same religion, two Catholics, one believes that, or most Catholics believes, is a direct connection with God. And it's up to your conscience and what you feel is best. And so it is not my job to tell you what to do. And to me, that's the American way. Your body, your religion, my body, my religion. But we've seen the churches come in and try to impose a particular interpretation that has actually never been in the Bible. The Bible does have, like, life begins at the first breath of life. And that doesn't happen till you come out of the woman and you breathe air, or that you at least have lungs, right? So know that, search the Bible and show me exactly where. There are, parts in the Bible that say that if a pregnant woman dies, you pay this price. But if a pregnant woman and her baby dies, it's a different price. So that tells you the two are not equivalent. The potential for a baby to come is a different thing than the baby is out and breathing on its own, separate from the mother. But absolutely, I hope that, I always like to say this country was built on religious freedom. And my mom is a Buddhist, and you would not want her religion to run this country. We don't want a religious government, because if she were to run it, if her party were to gain power, then we'd all have to be vegetarian. And sometimes we couldn't build houses because we'd crush an ant or some worms. So, your body, your religion, my body, my religion. This is not a theocracy. This is about freedom of religion. A lot of people came to this country for that. Please don't push one or the other.
I hear you. No, I hear you. My understanding is that, whatever you subscribe to, flow with that, but don't impose yours on somebody else, and let other people understand their religious orientation and respect that, and let them respect their own. That's a great bit of advice. Generationally, are you the first doctor in your family, or what's your lineage? I ask my guests this all the time because I'm curious about, I use this phrase, whose shoulders you stand on. And if you look at the Yen line, where do you come from?
I think my generation is the first generation of doctors in the Yen line. On my mom's side, my uncle was probably the first one. And I did, look up to him, but he was in Taiwan, and he came, my parents came from Taiwan. I was born in Chicago and then raised a lot in California. But he was definitely one of my favorite uncles and an inspiration, and mainly because those of us in health, we're here to make the world a better place. We're here to improve people's lives, and we have dedicated our lives to service. So the background is my mom was a nurse, so she was in healthcare, and she said, don't be a doctor, be a nurse, because the nurse do all the scut work and the doctors get all the credit. But I'm in primary care physician, and I'm like, be a nurse, don't be a doctor, because nurse practitioners can do anything a doctor can in the outpatient setting, and they don't have to go through the residency and the med school and all of that. And they get paid almost as much, if not more, because they're unionized, and often physicians are not allowed to be unionized. So, but I do love the healthcare fields, and I do love using science to make people's lives better.
Have you been watching and following Minnesota's legislature, the discussion we've had here about codifying, I guess, the women's rights and their choice to have abortions? Have you watched that at all? And what are your thoughts if you have?
I think it's so important because we need to take this out of religion. We need to leave medicine in the hands of those who are, it's the woman's body, her choice, in conjunction with the doctors. and leave medicine to doctors, keep religion out of this, and to not give me bodily autonomy if I'm sexually assaulted, or not to allow me and my family, because if I die, it messes up my husband and my children. It's not just me. And what I learned from my OB-GYN professor is that nothing will come between a woman and a wanted pregnancy and an unwanted pregnancy. So his thing is like, if a woman wants to get pregnant, she will get pregnant. So watch out. And then if she wants to terminate a pregnancy, she will.
Do it.
And by making it illegal, you don't make it go away. You just make it more dangerous. And as I like to say, I'm pro-choice because I'm pro-life. I know that if you make it hard to access, women will die.
Dr. Yen, how do people connect and get connected to Pandia Health? Is there a website or easy way to do it? Or
yes, please go to our website, pandiahealth.com. But we are also on all the socials, so feel free to follow us on TikTok, YouTube, Insta, Facebook. We do a Facebook Live a Tuesday. We kind of move it around at 5 o'clock Pacific in Espanol, because yo hablo Espanol. And then we do it at 5:30 Pacific on other days, and different birth control topics. We just went over generic versus brand birth control, TLDR, all the same, unless you're that 5% that notices the difference based on mainly the color in the birth control pills. And then we give tips there, and you're always welcome to hit us up for questions on any of our socials about the birth control pill, patch, ring, and soon to come acne and menopause, and evidence-based, cutting edge care.
Dr. Yen, thank you so much. This has been a great conversation. I've learned a lot. I want to have you back again in the future if you're okay. So I think it's an important conversation. And thank you so much.
Thank you.
All right. I'm Al McFarlane. This is The Conversation with Al McFarlane. What a wonderful interview. And, great information, great resource. And make sure that you and people in your life know that the resource is available here and anywhere else in the country. You simply need, internet access to connect with that resource at Pandia Health. Well, let me bring in my other guests for today. Robyn Bipes-Timm and Shereese Turner are with Twin Cities Habitat for Humanity. Robyn and Shereese, if I can call you by your first names, that would be okay, I hope. Okay.
Absolutely.
Welcome and good afternoon. What'd you think about the last interview, first of all? I thought it was great, but what did you think?
I love her passion.
Great. Oh, go ahead, Robyn.
I love her passion.
I felt that energy too. Yes. And to have such a strong advocate in this space is so necessary. So I so appreciate the work that her and her staff are doing.
Yeah, and I do too. And I feel the same way about you guys as well. I mean, what's important, I think, what the Al McFarlanes of the world ought to do is kind of both get out of the way, number one, but also lift up the genius of our neighbors in community and partners in creation. And that means to say and reflect our belief in the power and the right of women to lead, to create, to share, and to be co-equal authors of existence itself. And so in that spirit, I invite you to share what you are passionate about when it comes to home ownership and housing and the work of Twin Cities Habitat for Humanity. One of the things that I wanted you to talk about to start with is your home ownership program. Who's it for and who should be applying? What's unique about it? But let's start off with just Twin Cities Habitat for Humanity 101. Let's give the basics. I'll go to you first, Robyn, and then Shereese.
Sure. Well, many people might know Habitat because maybe you volunteered with one of our home builds. Habitat for Humanity is an international brand. In the United States, there are about 1,200 different Habitat affiliates, many locally based, really connected to community. In the Twin Cities, our Habitat affiliate has been here for about 35 years, a little bit over. And in all that time, we're building houses. We're building houses alongside our volunteers, with our homeowners, and really doing two things, really investing in the transformational power of homeownership. When a family has a home, they have a stable place, education outcomes are better, school outcomes are better, stability is just better as a whole. And super important, especially in the context of racial equity, your home is how you build wealth. It's what you lean into to go to school. It is your source of financial stability. And for way too long, homeownership has been out of reach for BIPOC families in particular, but especially in the Twin Cities. The gap between white homeownership and Black homeownership is deplorable, but we're the worst in the nation. And Minnesota's not used to being the worst in the nation. So Habitat 101, we build homes in partnership with community. We are also a mortgage lender. I don't know if everybody knows that about Habitat, but we provide affordable financing for every single person who partners with Habitat. And we are a coach, educator, and provider to really support homeowners through the whole journey. And Shereese and her team do a fantastic job providing those supports.
Let me say this about the two of you. First of all, for our listeners, Robyn Bipes-Timm runs the Affordable Mortgage Lending Program and Human Resources and Facilities at Habitat for Humanity. She also leads the organization-wide strategic priorities and initiatives. She's president of the Habitat's nonprofit subsidiary, which is called TCHF Lending, Inc. That is a community development financial institution. They're called CDFIs. And prior to joining Habitat, she was with the Greater Minnesota Housing Fund. She led its statewide rental and home ownership lending and programs. She's passionate about affordable housing and bringing equitable access and capital to underrepresented communities. She's got a BA from Lewis and Clark College, a master's in public policy from the University of Minnesota Humphrey School of Public Affairs, and she's got mortgage originator and realtor licenses on in her portfolio. Her colleague, who we'll talk to next, Shereese Turner, is Chief Program Officer at Twin Cities Habitat for Humanity. And in that capacity, she leads the Programs and Services Division. Before joining Habitat in 2018, she spent over 11 years in workforce development as the Director of Programs and Operations at Twin Cities Rise. Shereese is an inspiring and passionate leader who builds bridges with community partners and advocates for Black American community and underrepresented communities in Twin Cities. She's a co-founder of Stop the Violence, Bring the Unity movement, and she serves on the NAREB, which is National Association of Realtors. I think she'll give me the right name. I've worked with them before, but it's a real estate focused organization. She's on their board. She's also the Haven Housing Board Chair and co-chair of the Minnesota Business Coalition on Racial Equality Community Wellbeing Pillar. So doing a lot. Shereese, good to see you again, my friend. How are you?
I'm very well, Al. Thank you.
Well, let me ask you to jump in and talk about the crisis. I call it a crisis, and maybe it's not, but I'm disturbed that the ownership rate of Black people in Twin Cities has decreased and not increased. What's the story, and why is that the story?
Yeah, where do we start? Oh my goodness, we can go back to just racism in housing. It's embedded, it's just embedded into if we go back to redlining, just understanding how that impacted our Black community. We wasn't able to live in communities that we really wanted to live in. We were shuffled in communities that, there were some health disparities. If we talk about environmental issues and things like that, this is our history, and it's ugly. It's ugly. And then you have that domino effect of how it's impacting us in the 21st century. And most importantly, in our region. Our region is troubling because I remember understanding that there were certain communities that was pretty, it was daunting to, just to see what was happening in the Lake Harriets, why there wasn't a lot of Black people living in these areas. We were shuffled in certain communities. When I first relocated here from the south side of Chicago, I resided in North Minneapolis. I saw a lot of us in North Minneapolis for renting, not a lot of homeowners. So that was a little troubling for me. I remember telling my mom when I first moved here, who was working for the city. I remember there was some construction going on 26th Avenue North in North Minneapolis. They were repaving that entire area. And I saw not one Black person paving that area. And I couldn't understand, like, these are the jobs that are entry points to middle class where I just left. And I saw not one person of color working, rebuilding the pavements on that street. I was starting to, understand there is something else going on here. I couldn't put my finger on it. And that was really what drew me to workforce development. And there was some history there too, because here we're living in this very liberal state, a melting pot that welcomes people like myself into the communities. I remember one of my mentors basically stating that what is very unique about the Twin Cities is that we will invite you to the party, but you may not get the directions. Interesting.
And if you don't show up, if you don't show up, it's your fault, right?
How to get there.
That's
so
right.
if we think about these sectors, I think that's kind of what it is. You're kind of invited, but you don't have the navigation tools to get there, to land a job, a good paying job, or to understand the importance of home ownership, or how do I even access it, right? Because let me just be reminded that here I am, a first generation homeowner in my own family. My dad was unbanked his entire life. So he had no idea what even a banking relationship was. So here, as a young adult, I'm already operating a deficit of understanding how do I connect to a bank, right?
No experience.
No experience. So, but I'm not the only one. I know I'm not the only one, because I also know quite a few first generation homeowners that are my friends, you see? So this is just something that we have dealt with. But what I appreciate about Habitat is that we were able to have these conversations in 2018, like what is really going on in the Twin Cities? And we dug deep, trying to understand what is happening within our own program, you see, because some of these same barriers that I saw outside was kind of inside it in Habitat. But we were willing to talk about it and try to really uncover what is happening. And what we were able to uncover is that those same things, ugly things that we saw outside of Habitat, yeah, we kind of had a little bit of that inside of Habitat too.
It's implicit bias, right? Or how do you describe that?
Yeah, I would describe that. Yeah, exactly that. And sometimes it's just easier work. It's easier to work with certain demographics, considering that we come with a lot of pain and trauma. Yeah. So it's not uneasy for us. We have to kind of got to pull off these layers. This onion, you got this onion to keep pulling those layers off.
Yeah.
But the reality is that, we don't know what we don't know. So that goes back to my original comment about my dad being unbanked. Like, okay, then we wonder why we're dealing with debt and credit and it's embedded in our pathology. But once I know better, I do better. And that is really what Habitat is committed to, is educating us on what it is that we need to do better, paying down some debt, but also creating a program model that's going to work for us, because we understand the unique barriers that we carry and the trauma that is impacting our communities from building wealth. So these are just
As Robyn said, the Twin Cities is, or Minnesota is the worst in the nation in terms of the disparity in home ownership. I pulled up an article that was on CNN, and the article is entitled "Black Home Ownership Rate is Now Lower Than It Was a Decade Ago." It's a piece by Anna Bonney, and it was published, this was published in February of 22. So it's a year-old article, but it lays out some of the concerns that you both are talking about. And it says that even as home prices skyrocketed during the pandemic, home ownership continues to grow. But the rate of home buying has not increased at the same pace for all Americans, according to a new report from the National Association of Realtors. More Americans own a home now than in any year following the Great Recession, with the U.S. homeownership rate climbing to 65.5% in 2020, according to NAR. That's up 1.3% from 2019, and it's the largest annual increase on record. But Black homeownership at 43.4% remains lower than it was a decade ago, and it's nearly 30 percentage points behind white homeownership, which is at a rate of 72.1%. Meanwhile, Hispanic rate rose to an all-time high, reaching over 50% for the first time, and the Asian homeownership rate is 61.7%. So the focus here has to be on why is the problem of Black homeownership such a problem. And I think you said earlier that if it's 43% in the country as the average, I think it's down to what, 20% in Minnesota? Do you have those numbers?
Exactly right. Yep.
Yeah.
Depends on the year, but somewhere between 19 and 24% Black home ownership rate. And and one thing I want to call out, so the work that Shereese is talking that we most recently did, you know, we've been around for 35 years. We do good work. About 80% of our clients are clients of color over history. So Habitat has really been good about supporting the home ownership path of anyone who comes to us, but we've been very effective, in particular, supporting the immigrant community. We had never disaggregated even that category of Black home buyer. When you pull that apart, when Shereese with her leadership and Chris Coleman with his leadership at organization tasked us to pull apart, you know, how many Black homeowners does Habitat have? 50-60% of our clients were Black, but when you looked at the data, we realized African American clients, U.S. born African American clients, that was a woefully lower number. They are the second largest group of families coming to Habitat for home ownership, but the second lowest graduating. So there was even a disparity in the category of Black home ownership. And whenever I see these national studies and state studies, I always want to say, well, pull that apart a little further. Yep. See how big the gap is for foundational Black home buyers. I'll hand it over to Shereese for this because all her great work in programs and services. But I think part of the problem is that too much of the lending industry and the mortgage industry has focused on getting people into the home rather than what is the sustainable preparation and supports post-closing to keep families in their homes so they're not losing them. Yeah. Shereese is the expert in that space.
Yeah, I would just expound a little bit because during the last housing crisis in 2008, 2009, when I was in workforce development, it was pretty clear that many of the participants that the organization served at that point was also some homeowners. But the recession was impacting the workforce at alarming rates, and many of them were facing foreclosure. And we have a foreclosure prevention program here at Twin Cities Habitat for Humanity, and we're seeing the same numbers of those homeowners who are partnering with us to help prevent foreclosure. Are also about 76% of them are African American homeowners. So so what we like to take pride within our programs and services, there is a post purchase support program. We ride with you as long as you have that mortgage. So at any point you run into a little bit of hardship, like COVID, that impacted a lot of our homeowners. Mm-hmm. And we were there to ride along with them, to help brainstorm, to think about budgets. How do we, be the conduit between you and your servicer? And these are this is program, our foreclosure prevention program is not just for Habitat homeowners. That's available to any homeowner in our 7-county metro. And we take pride on providing this resource to our community because we know it's a necessary one, especially during this period.
Let me ask you both to dig deep on the big question. We talked about financial literacy as one of the tools necessary to improve and increase homeownership, to improve and increase a family or individual's sense of direction, right? To see herself or himself as a homeowner. And so how much of the disparity can you place in lack of information, lack of knowledge, lack of those two things, just lack of understanding in the Black community? And I'll say that specifically the Black American community, because you've described that, Robyn, as the center of the negative report. And so how much of that do we lay at the feet of the individuals? And how much of that should we be pointing to institutions, banks, government, public and private resources that, in my view, often aid and abet
Absolutely.
the marginalization of Black people in particular, people of color, women in general? What do you think, Robyn and Shereese?
Maybe we can do that together. I'll answer sort of that institutional, what do we need to do differently? And if Shereese, you want to lean into the client experience and what we need, what works on that side. Elle, I think you got it exactly right. First of all, one thing is one size does not fit all. And what our African-American homebuyer clients need from us is a customized, human-centered approach. And as an organization, we can't expect that one program, one mortgage product, one amount of down payment assistance is going to get everybody across the line. We need to customize those pieces. And that's one of the big learnings we've had over the last couple of years. We mentioned it probably in the introductory comments, but as part of our new strategic plan, we are explicitly centering Black home buyers as part of our Build Forward Together campaign to create more homeownership. And we're doing that because of this huge gap in our own program, second highest group applying, second lowest. So we listened to clients. What do you need us to do differently to support you on your journey? And we came up and we are responding by changing the way Habitat does business. We have an advancing Black homeownership program explicitly for people in the Habitat program who are stuck behind credit barriers, savings, lower income, dissatisfaction with the journey, the homeownership journey with Habitat.
Mm-hmm.
And we've redesigned our program to offer 3 major supports. And I'll have Shereese speak to the coaching and the financial readiness one in particular, but the 3 different supports we're doing differently. We now created a more flexible mortgage product that understands the credit barriers of foundational Black home buyers. So more flexible on student loan debt, income, more flexible on debt to income. We're also providing more home buyer financial support, savings support, down payment assistance at deeper amounts, because home prices are way out of reach in the Twin Cities and incomes are not moving. So more help is needed to support those homeowners. And the last thing is we're providing our coaching and financial preparedness differently. And I'll let Shereese speak to that. But we're doing all of this under a special purpose credit program, which is new guidance federally that banks and nonprofits and government agencies can be as explicitly race-based in our solutions as the problems were explicitly race-based and excluding Black homeowners. And so even though Habitat's been here 35 years, we've had a special purpose for 35 years because everything we do is special. But us being explicitly race-based with this advancing Black homeownership is absolutely new. And we hope that other nonprofits and banks and lenders will lean into this as a set of tools to meet clients where they need to be.
I think that's a big deal. Last night, my wife Bobby and I were watching a news report where attorney Ben Crump was holding a press conference. Some of you may have seen it, about a woman. I'm not sure what town she's in, somewhere in the South, but she had deposited $700 cash into her ATM teller at the credit union that she'd been a member of for 50 years, 47 years. She's a teacher, and it was a teachers federal credit union. And she went the next morning to withdraw the money to make her mortgage payment, and was met with all kinds of questions and disbelief. And even when the people in the bank discovered that the ATM that she used outside of the building in the evening before was actually being repaired because it was malfunctioning. And even though she had a receipt for the deposit she'd made, they were having difficulty believing her and wanting her to come back 2 or 3 times to get her money, or to put the money into her account. And she wanted it in her account because she had her mortgage with that credit union, and she wanted to make sure that her mortgage payment was paid on time. She wanted to protect her credit. She also knew that, this is her words, not mine, white people will take your property from you, you know, if you don't pay your bills, right? And so she never wanted to be in a position to have her property taken because she hadn't made her payments. Well, that's one story. And so that's why I raised the question about the institution. So here are a series of people in a financial institution, and by their subjective, actions, they ended up causing this woman to be arrested, a 70-year-old retired teacher, arrested, jailed, held overnight in a jail, stripped of her clothing, in a kind of a psychiatric hold by people that were not psychiatrists, right? That's a PDF there. Florida Women Sues Mid-Florida Credit Union over alleged race discrimination. So that is not untypical. It's not atypical of the experience of Black people in this country. And Robyn, the reason I'm drilling down on this is because I think that kudos to Habitat for saying we need to pay specific attention to the situation that has resulted in Black exclusion, Black suppression, Black poverty, and it's not particularly and exclusively the fault of Black people. It's the work of white people and white supremacy that has led to a series of policies and programs, and spoken and unspoken, that result in the continued marginalization and deprivation of our people. So that's one thing. Robyn, Shereese, let me turn to you, and let's talk about the other part of that, how we have internalized that experience. Two stories, I'll say them quickly here. One, you might have remembered Eddie Murphy in one of his Saturday Night Live shows where he went into somebody walked into a bank and was talking to a white lending officer and wanted to borrow some money but didn't have the qualifications according to the Black officer. And the guy said, well, let me talk to somebody white. And Black guy dismissed, white guy comes out and just hands over oodles and boodles and oodles of money. White people taking care of white people, and they clean it up later. That's one thing. I leave it with this thought. I say too often that in our experience, from my point of view, we get the misery, they get the money, and that white people make Black misery their business. My objection to me and to others is to say no more, that our health, our wealth, our homeownership, our politics, that's our business. And we have to be businesslike and expect of ourselves and demand of society at every level respect and equity in our share, without begging for it and without apologizing for it. Shereese, the last note here is that when a Black person gets turned down for a mortgage, we think that's the end of the world. We did something wrong. We're just not ready. White people will go to the next, till they find somebody that will give the mortgage. If they get the first mortgage, they say, thanks, go next, negotiate for the best deal. How do we educate ourselves to be our best advocates in creating change and opportunity for ourselves and our families and our community? Shereese Turner.
Yes, absolutely. Thank you. Thank you for that summary, because you're exactly right. It's important. When I even what we're trying to do differently here at Habitat is ensuring that there is relevant peer to peer. I can't be what I don't see. So it's important that we are very reflective of those who we're working with and who we're serving. It's important that we also talk about the uglies of our past, because that's going to really help us inform how do we move forward. Even with Habitat, we were able to understand that, and these are the things that we're going to do differently. But as it relates to the slow yeses, I'm not going to say declinations or, you're not eligible, to slow yeses. These are the things that we need to do differently so you are qualified. What we have to do in our Black communities, have real conversations around our spending, her debt, but also not to be afraid of just understanding your credit. What's on your credit? Do you understand what's contributing to that low credit score? And this is not for everybody, but these are the folks that we do attract here at Habitat. And we want to make sure that those that are dealing with the financial trauma, it's also developing financial resilience. How do you overcome that? Again, going back to my dad being unbanked and not having even having credit, understanding how we can use that to advance, but also do it in a way that is healthy spending, healthy debt. How do we pay some of that debt down? Again, understanding that I was pushed this American dream and I had to obtain, all these letters behind my name and get this advanced degree, but didn't think about what that would cost me. So having real conversations around student loans, and think twice before you take that out. I was intentional, because I learned the hard way. I was intentional about making sure my children, adults now, when they graduated, didn't have any student loan debt. So I was able to access equity in my home so they didn't have to go through what I went through.
House is a gift that keeps on giving.
Absolutely.
Listen, we're out of time. I want to thank Dr. Yen. She's backstage making wonderful comments. She said Chinese and Taiwanese are always taught to buy your home. And if you can, and work towards that, to never rent if you can avoid it, once you're out and working. So thank you, Dr. Yen, for that comment. Well, end of the program, great program. My thanks to Shereese Turner, to Robyn Bipes-Timm from Habitat for Humanity. Join us tomorrow at 1 o'clock online at the Insight News YouTube channel. I'll be talking with a friend of mine, somebody respected in the community, in the art world, and that's Peter Brosius, the director of Children's Theater Company. It'll be a great conversation. We'll see you tomorrow. Take care.